Hi, and welcome to the Functional Relations Podcast. I am Zachary Bird.
And I'm Caleb Davis.
Why is it taking 3 seconds to Are you not hearing me in real time?
Sorry, no, I was not paying attention.
Okay. Welcome to the Functional Relations Podcast, where we set aside time to have engaging conversation on relevant topics related to behavior analysis. I'm Zachary Bird.
And I'm Caleb Davis. Hi, Zach.
Hey, how's it going?
Doing pretty good.
It's episode 3.
This season, it's flying by.
People must be getting so tired of our voices now that the season's going to be halfway through.
Yeah, but we're just going to keep delivering the content.
All right. Let's keep it rolling.
All right. So what are we talking about today? What's on the docket? What's on the docket for today?
Well, alternatives to extinction. And we use the term, just between us, we kind of use the term follow-through ABA as a way of describing a specific type of maybe programming or something that involves...
Right, because people always say follow through. Follow through, it's important. You have to follow through.
That's right. Yes, if you just follow through, all your problems will be solved.
It's like you're shooting a three-pointer and you have no follow-through.
Yes, right. Yeah, you got to leave your finger in the air for a few seconds.
But not too much, because then it's showboating. So you got to follow through, but not too much.
It's a fine balance, for sure. As it relates to ABA, though, follow-through is kind of synonymous with escape extinction.
Right.
But what is escape extinction, Caleb?
What's extinction, I guess?
Ooh, good. Yes, I was thinking the same thing. Let's just break it down.
Right.
Extinction is the discontinuation of a schedule of reinforcement.
Yeah, that's right. So you have to have an existing schedule of reinforcement, some contingency that's in place, and then you just cut it off. You discontinue it. Mm-hmm. So you're no longer delivering that reinforcer contingent on the previously reinforced response. That's how I understand it.
So then, when we talk about escape extinction, the escape part would mean that it was previously a response to escape aversive stimulation.
Right. So you have some aversive, unpleasant situation or activity or context, and then you engage in some sort of behavior and things are improved in some way, right?
Right. Well, specifically as it relates to aversive stimulation.
Right, like an improvement in the sense that it's less aversive.
Yes, right on. Yeah. Okay.
Yeah.
So then when we think about follow-through ABA, can you give me an example? Something that you've seen in the past or you've done in the past that relates to escape extinction, and someone might term that follow-through ABA.
Yeah, so I think... I'm trying to think of an example. Let's say that if you have a student, maybe you work in a school setting, and a student's break time is over, and it's time to move on to the next class or activity, and you say, time to transition. Here we go. We're off to gym class or something like that, and perhaps
and the kid said, "No, I'm not going. I hate gym class."
Right. I don't feel good, or they don't want to do it, right? So that behavior, that kind of protesting behavior, maybe in the past had resulted in escape or avoidance of the transition. So maybe they were given more time on their break or something like that. If you're going to implement escape extinction, what that might look like procedurally might be say, oh, no, break's all done, and you sort of require the student to still transition regardless of their protesting behavior.
Okay. Now, there are probably a number of ways that you could carry this out, right? Some people, It's very simple. You just say, oh, I'm sorry, no, break's over. Let's go. And then they're like, okay, fine. then, there are other people that might be more resistant.
Yeah. I think when I think of escape extinction, I often think of like really messy situations.
Yeah.
So I think of maybe you have like a smaller child with like maybe autism or some other developmental disability. Maybe you're trying to work on early learning skills like sitting at a desk or staying in an instructional area where you have a bunch of instructional materials, and maybe you're working on some discrimination skills or something like that. And maybe they're just like trashing the materials. They're trying to get up and leave, and like all this behavior is likely
Flipping
maintained
the
by
chair.
escape. Have you?
Yeah, right.
Yeah. So I mean, obviously there's some things probably you can do on like the proactive side of things as far as like having like reinforcers and things like that. But for me, there's like the stereotypic escape extinction procedure is like you keep the child there and you like hand over hand or use some sort of like physical guidance to have them complete the task, even though they're like pretty upset about it. Like that's kind of what I picture when I think of like when somebody says escape extinction. I kind of like get like this like image that pops in my mind, and that's what it looks like.
Yeah, it's like PTSD for me. It's like right. Oh, I remember all those terrible battles I had with those people, and it never felt like it turned out very well. It was like a lose, lose, lose. But I would say, so this procedure can be very effective because, like we said, you're discontinuing a schedule of reinforcement. So basically the person's like, okay, well, I'm not going to win that battle. Then we move on and we go to gym class. But you actually have a great example that you've shared with me several times before in the past. And it kind of like brought it into perspective for me. And the example was like how...
I actually can't remember what it is, so I'm kind of excited to hear what this great example is. Because I don't know what you're going to say right now.
Well, the thing is that in the past we've debated whether after you run escape extinction, whether you should put a reinforcer after. So let's say you get the person to gym class. Should you then deliver a reinforcer for making the transition? And this is a thing where we've kind of debated over the years, and we've actually thought about like different ways of doing it. But when I think of follow through ABA, I think of essentially using escape extinction and also not using positive reinforcers. So it's like this combination that I think is like a little bit problematic sometimes. Whereas in the case that you gave me one time, you said, like, let's say you didn't want to go to this new sushi restaurant. Do you know the example now?
Oh, yeah. Okay. I know what you're going to talk about now.
So let's say you didn't want to go to the new sushi restaurant, but...
Because I'm very rigid. I don't like trying new foods and things like that. I would just eat at the same restaurant, eating the same meal every day because I know I like that meal. And why risk going someplace else and possibly having a meal of food that isn't as good as the usual?
Yeah,
right?
I mean, that's true. Except for you'd still be eating your mac and cheese every single day for every single meal. And that may not be that healthful. And it's good to have a variety of different foods. But anyway, so let's say I said, Caleb, we need to go try out this new sushi restaurant. It's on your goals, and we need you to have a variety of foods. And so let's go. And, you're saying, no, I'm not going to go. I'm not feeling well, and I'm tired. I think I might take a nap. But I say, no, come on. I pick you up, and I carry you out to the car.
You use full manual guidance to transport me to the sushi restaurant.
Yep, exactly. I put you in your car seat. I meant seat of a car.
Like a yeah, not my adult car seat.
And then I buckle you in.
Complete with like a juice and a plate, like a small thing of Cheerios.
Actually, no, we're talking about no positive reinforcement here. So then, and no non-contingent either. So we get you to the sushi restaurant and we say, okay, you made it, you made the transition, you didn't feel good about it, but here you are. Now, because you didn't come with me today, you're not going to be able to order off the menu. So next time, make sure.
What you mean by that, though, is because you required escape extinction to get me there, I can't have any food.
That's right. So essentially, the reinforcers for even making the transition have become basically nothing. So what you learn from that is like, oh, this sushi restaurant sucks because I don't even get any food. So so the kind of moral of the story is like, it may be important to have the person contact positive reinforcement once they make the transition.
Yeah, no, exactly. Because I think about that example, it might be in time, I might still just be compliant to go to the restaurant, even if I'm not getting food, right? Like if you're like, oh, I had to give you a hard time to get you to come to this restaurant today, so you're not getting food. Like over time, I still might eventually become compliant, but it might take longer, and probably I would like have some not very nice feelings towards you, Zach.
That's true. Yeah. And that's
versus if we get to the restaurant, you're like, I know I had to give you a hard time to get here, but hey, let's try some sushi. And then before you know, we're having a good time and eating sushi, and I learn it's like not that bad, and I'm actually enjoying myself.
Exactly. That's right. Yeah. So that was the example I wanted to share. That I thought that I like that example because for me, there are times that I don't like want to go places or don't want to do things, but then once I get there, it's not so bad because I contact positive reinforcers in the process. And so people don't have to drag me to those places as much if I'm able to contact some positive reinforcement once I arrive. Now, from your perspective, what are the concerns around escape extinction or follow through ABA or whatever?
Yeah, I mean, I think at least a couple things popped to mind. One is there's like this safety aspect of it, right? So
yeah.
I think you and I have both had the experience where we like physically cannot implement escape extinction because maybe the client is just too large and strong and that maybe the type of escape behavior they have is too dangerous that you can't implement escape extinction. So that's like kind of like one of the first things that pops to my mind when I hear escape extinction or consider using it. It's if I can safely do it or do it at all.
Yeah, right. Yeah, there's escape extinction as like this procedure that a lot of people actually can't follow through with. They can't follow through with following through.
Yeah. and also I think like sometimes, and I've heard other people talk about this, is that escape extinction as a process is maybe sometimes confused with a procedure, right? Like the only way to do escape extinction is to like hand over hand, like manually guide somebody to do something. But that's just a procedure. But there are other ways and maybe less intrusive ways of that might have the same effect. At least in my experience, that's the case.
Right. So yeah, safety concerns. I also think about things, which is kind of what you just mentioned, which is just like, can you do it? So even if you could do it, it might be unsafe. But then it might be unsafe and you can't do it. So then you're just like, that's a second problem.
Right.
I also think one of my concerns about it is how common it is to use escape extinction without the positive reinforcement in place. Like it's like you have to provide. I mean, if you're going to use it, I think that's first of all, it's a procedure. It works. It can be effective, but we have to, in the same way when you're using punishment, it's really beneficial when you're using extinction and probably best practice to use some positive reinforcement for compliance, positive reinforcement for the other types of alternative behaviors that you might be wanting to teach. And if we don't do that, then we can be in a dangerous spot. Dangerous in the sense that maybe actually dangerous, but also in the sense that it might not turn out the way we're hoping because we're not teaching.
Yeah, I think some of the ways, like when I think about extinction, I almost in practice now, I almost always assume I can't implement extinction. Because I think even when we say like we're implementing extinction, I don't think we usually are. I think we're maybe like trying to thin the schedule like to a point where behavior is unlikely to maintain,
like
while at the
ratio
same time
strain.
introducing, yeah, like to say it, like for instance, if you're trying to get a team of people, maybe like parents and like all other caregivers, to not provide like attention for attention maintained behavior, I just don't think it's realistic in my experience to expect that attention is never going to be delivered by anybody. Like I think usually you're looking at trying to minimize
Right. And what
the delivery of a reinforcer. And then at the same time, that's where it's like you need to be introducing some contingencies where like appropriate behavior is reinforced, right? So if we think about like escape extinction, yeah, try to like minimize escape, but also like provide some like positive reinforcers for like compliance or something like that. That's what drives the
exactly.
What is it? What drives the boat? Drives the ship? Drives the, I don't know what the expression is.
I don't know.
Maybe it's not one.
I think your example of attention extinction is very good because, people when they start out on the journey of like, yeah, let's just put the, he's kind of yelling a little bit in class, or, he's not raising a hand, so whatever. So let's just put that yelling on extinction and no problem, right? And then like, 2 weeks later, the kid's standing on his desk, chucking his pencil at his neighbor, and then picking up his chair over his head and seeing how far he can chuck it across the room. And it's like, wait, how did we go from having a loud outside voice to chucking the chair across the room? And it's like, oh, because we didn't really think about necessarily how attention extinction might end up.
Right. And well, if you think about it, if you're only using extinction, so extinction alone, what extinction does, as you know, is it produces like a ton of response variability, and you could end up with like more intense topographies
that will contact reinforcement.
Yeah. And unless you're prepared to place all of those more intense topographies on extinction, you're just probably going to be in a worse place than you were before.
Yeah.
Right. So you kind of like need to know, like, if you're like, oh yeah, we're going to ignore like some like a minor problem behavior, you better be prepared to place all the more extreme topographies on extinction, or maybe thinking of alternatives.
Yeah.
If you can't do that.
Yeah. So, okay. So I think, some common examples that I've come across is, I feel like toothbrushing, for some reason, some people just don't like to brush their teeth, and I understand that.
I hate brushing my teeth.
Okay, so there you go. You understand it too.
Yeah.
And you probably really hate it if someone was manually guiding you to learn the steps of toothbrushing as well.
Oh yeah.
So
I'm out. I'd be out.
yeah. It'd be
try getting me in that bathroom if I know you're gonna like brush my teeth for me.
Yeah, exactly.
See you later.
you'd be like,
I better be getting like a Snickers bar when I'm done brushing my teeth.
Yeah.
Which defeats the purpose.
Yeah,
so you should just not brush my teeth.
They'll be like, okay, your teeth look brown now from your Snickers bar. We need to go brush your teeth.
Yeah. And I'm just like in this awful cycle.
Yeah.
Hey, sorry to interrupt, but if you're a BCBA and you're interested in getting ethics CEs for listening to this episode, you can purchase them at functionalrelationspodcast.com. Each episode is worth 2 ethics CEs, and you'll need to provide 3 code words when you go to check out. The first code word for this episode is tuba, as in the large musical instrument, tuba, T-U-B-A, tuba.
Now that we've kind of discussed, there's these kind of things, there are alternatives to escape extinction, right? So in some sense, we're telling people, I don't know if we're using some sort of, I don't know if it would function as a punisher, or we're trying to develop some rule. But now that we've kind of discussed a few examples of maybe some of the difficulties with escape extinction and maybe some of our concerns about it. And some of our experience with using it has been a little bit discouraging for us, I think, over the years. And we've run into some problems. What are some alternatives? Because in some sense, I don't think we're saying like, or at least I'm not saying, don't use escape extinction. What I would be saying, I think pretty strongly, is don't use escape extinction when you don't have positive reinforcement contingencies in place for alternative behavior. But we need also, I think, alternatives to when you can't use escape extinction at all.
Yeah, right. So I mean, my thought is like, obviously there's a good amount of research out there on like the use of extinction and punishment. And, in some cases it's been shown that like sometimes you just need extinction and or punishment included as part of a treatment package to make it effective, right? So like it's out there. And I think by talking about it, the important point for me to think about is that when we're using it, we're thinking about how like positive reinforcement plays into that. Because when I think about like a successful intervention, I think about maybe one that includes escape extinction, but it's not like the main course. If you think about like, like it's like Frosted Flakes, right? It's part of a complete breakfast, maybe, but you wouldn't just eat Frosted Flakes on its own. Nobody's going to tell you like to do that. So, I mean, at the end of the day, you have to have like strong reinforcement contingencies, like positive reinforcement contingencies. And then to maybe like kind of get you over the hump, I think that that's like where like maybe extinction and punishment components might play in, but those shouldn't be like what the intervention is. Like those shouldn't be like you know what I'm saying? Yes. Does that make sense?
Yeah, you need your banana, you need your toast with some peanut butter. You can't rely on the Frosted Flakes to get you through the morning.
In my experience, maybe people have had other experiences. If I encounter a client that is engaging in a lot of escape maintain behavior, rather than simply saying like, okay, I'm just going to like kind of follow through in this situation that I'm in, I think it's important to, and I've found helpful, is to take a step back and kind of look at like more broadly, why are they engaging in this type of behavior? Like, do I have adequate like positive reinforcers in place? Do I need to maybe temporarily remove demands, pair instructional environments with the delivery of positive reinforcers, and then gradually reintroduce maybe those things that are evoking behavior? So I think, in my experience, rather than just following through, take a step back and kind of think about why is this even occurring to begin with? And are there other pieces that we're missing related to positive reinforcement?
Yeah, that's a great tip. And I think there are some people that are working on this, and I think it would be really valuable to see if we could talk to some of them, or maybe one of them, or something. Have you heard of the work that Robert Schramm and Megan Miller are doing?
Yeah, I have heard some of their stuff about the 7 steps of gaining instructional control.
Yeah.
And I've heard Megan Miller talk about similar, I think very similar to like how we're describing it right now, of like not implementing escape extinction and like kind of like looking at alternatives and how you can still be able to get people to engage in like probably important tasks that they need to do.
It might be interesting to see if we can get some more insight from people who are focusing on this in their work. Do you have any questions that we might be able to ask them?
I'd like to start with more of a broad question, which is, what are some of the ethical considerations for the use of escape extinction?
Okay, yeah. Right. That's a good place to start, I think.
I think we've kind of described like what our thoughts are on that, but I would be interested to know like what others in the field have experienced as well.
Okay. Yeah. So I would be interested in asking a question about essentially the restrictiveness of the procedures. So you might find that there are some escape extinction procedures that are less restrictive than others. So those might be good alternatives. We know that there are ethical considerations related to using least restrictive procedures. So maybe we could ask something about that.
Right. Like maybe, because there's a big difference, I think, between hand over hand manual guidance and just waiting somebody out, but keeping the demand in place, right? So that's kind of like a spectrum maybe of, cool.
Okay.
I think also what we can ask is, what are some alternatives to escape extinction?
Right. Well, yeah, we need to,
like, let's say there are some situations where it's unethical to use it. We need to think about alternatives, right? Because we still have a job to do.
That's right.
We still need to serve clients. We still need to develop effective treatments. So yeah, what are the alternatives if maybe it's not appropriate for us to use escape extinction procedures?
Okay, that would be great. So let's go talk to some people.
Let's do it.
Welcome, Dr. Megan Miller. Thanks for coming on the podcast. We really appreciate your time.
Thank you for having me. I appreciate being here.
Dr. Megan Miller is a co-founder and the Director of Outreach and Development at Navigation Behavioral Consulting. She also started the #DoBetter movement on social media. So first person we thought of was you when we were having this discussion about the ethical use of escape extinction, because we know you've done a lot of work in the area of using positive reinforcement and potentially reducing the, I think the way you've described it is force prompting. And so we thought you'd be a great person to talk to.
That's very good to hear that you thought of me about that. I have been speaking on it for quite some time. A lot of the times I'm a practitioner, so I haven't done a lot of research work on it. And then that unfortunately doesn't mean much to certain areas of our field,
Sure.
Even though as a practitioner, I've been doing work in this for 11 years or longer.
Yeah. Yeah. And I think just some, I think everybody has their own role to play. Some people will have the role that, okay, they should do the research on this topic, but there's the other role in our field that maybe should be given more credit, which is to bring awareness to these issues of common practices in the field that maybe people should be thinking about before they just kind of jump into or make their kind of default programming around these kind of procedures. So
yes,
we were wondering if you had any thoughts about ethical considerations for the use of escape extinction.
Yes. Well, I have a lot of thoughts about it.
Yes, great.
I have a whole entire training I do on it, but I know we don't have that much time today. We're going to talk about a few different things. So just some of the main points for the ethical considerations. You actually brought the one up in that question, that blind application of escape extinction or extinction in general. A lot of times there is a tendency in service provision, instead of doing a functional assessment or a functional analysis when necessary, to just assume what the maintaining reinforcer is and then remove it and apply extinction right away. So there's blind application without any confirmation of the function. And then you can obviously see ethical issues there when the behavior may not decrease and it may get worse because you could be potentially reinforcing it, especially with force prompting. A lot of the clients that we've worked with that people try to use force prompts with, and that physical interactions reinforcing. So then their escape behavior increases, and it's not even truly escape behavior. It's
Right.
Challenging behavior occurring in the context of demands, but the function is not related to escape. So that's one. The other issue, especially that comes up with escape extinction, is the battle that can ensue. So with the force prompting, when looking at like least intrusive interventions and things like that, and just the public image of our field, it's one thing if you're, if you're prompting someone who's actively engaged and learning from those prompts, that's perfectly fine. But when it starts to become that resistance piece where you're trying to get their body to move one way and they're trying to move the other way, and it turns into that physical battle, then you're running into issues where obviously that's not a positive experience for anyone. So the additional stress that causes for the interventionist as well as the client. and the potential for harm, like physical, injuries and things like that. And a lot of people, I mean, I don't know about you, but if anybody were to try to make me do something I didn't want to do, you're just physiologically going to go into a fight or flight type response.
Yeah.
So,
right.
So that's not obviously beneficial either.
That's exactly right.
Yeah. Some of the side effects too of forcing compliance. This is one that I talk about a lot. And then I usually get emails asking for research. I don't currently have any. It's just my logical analysis. And that's a whole separate podcast if you all want to do one sometime on how you can think and not have to rely on research for everything. But just from my logical analysis of, I mean, obviously you could look up research on learned helplessness and things like that. But when you go through that process and you basically, from like a respondent standpoint, you're either going to get into a situation where the person continues to fight you, and you continue to have that fight or flight situation happening, or they eventually just start giving up and they learn to just do whatever you are telling them because there's no way out of it. But then that doesn't help for true situations that would occur for that person that are dangerous then in the future, if you think about it logically, right? So if someone's trying to sexually abuse them or bully them or things like that, and they've been taught you just have to do what people say, then that you've basically extinguished and suppressed all of their natural tendencies to fight back against aversive things. So I think that's a big issue. I mean, obviously more research needs to be done to prove that it can happen, but I don't think it's a huge leap to think about that. And there's animal research on it, from the basic labs. I don't have the citations, but that was one of the early findings with like shocking rats, that they would eventually just stop responding. Right. So, and then just from a treatment standpoint, and most people in the public aren't necessarily open to engaging in force prompting or the typical methods that are used with traditional escape extinction. So getting that social validity and the buy-in for treatment, either, again, we're ruining our public image because people are like, heck no, I'm not doing that. I hate ABA, see you later. Or they might agree to it, but then they don't implement it with fidelity. And then the behaviors can increase in intensity and things like that as well. Those are the big four that I typically bring up and can go into a lot more discussion on, but those are the main ones that I talk about.
I can definitely relate to I think dangers that you pointed out of just creating like clients that are super compliant with everything. Cause I think oftentimes in my clinical work, that seems like that's the goal of everybody, is to just, create a program where somebody tells somebody to do something and they just follow that instruction regardless. And I think that also relates to people sometimes object to doing things like treatments that involve functional communication training for asking for a break, because people are concerned that, well, now the student's just going to ask for a break all the time. And I think rather than being focused on why aren't they doing it, we should be focusing on like, well, why are they choosing to take a break all the time? Like, what's wrong with our programming? You know what I mean?
Right.
So I think like considering self-advocacy skills is like really important.
Yeah.
Rather than just creating somebody who is like, yes, sir, or yes, ma'am, like whenever they're told to do something, regardless of what it is.
Right. Yep.
Yeah, I mean, that type of thing would never fly in the areas outside of developmental disabilities. It's like we're taking advantage in some way of someone having a disability. I just think that's, I mean, if someone were to say, like, the only reason you're doing this is because this person has a disability, they would be shocked that someone would say that. Yeah. But it's like, you're not doing this to typically developing people. Like, you're not forcing. Yeah, I guess that is true.
But there are some people that might, but
that's true. It is true. But for the most part, you're not taking a 15-year-old and forcing them to work on their math homework. And I think that's just something that, for whatever reason, we've often forgotten about the vulnerability of the population we're working with. And I think the position you mentioned about compliance is a very important one to remember. Yeah, so thanks for bringing that one up. Those are some excellent points.
I think Zach and I also, in some ways, were fortunate early on in our careers where we worked with clients where escape extinction just was not an option because they had such severe problem behavior. They were 200 pounds and engaged in like severe aggression. So it's like you had to kind of throw escape extinction right out the window. And so I think early on, we were lucky enough to start to think about other interventions outside of just forcing somebody to do something.
Yes. And that's kind of how I got into doing this so early as a practitioner as well. I was fortunate to have a few, and they weren't 200 pounds. They were little, 4 or 5 years old, but there was that situation where they found the force prompting or like the trying to get the follow through on the demand. They just thought that game was super fun, and it was really reinforcing. And it was obviously reinforcing, like laughing and, looking at you as they tried to run away. So it made it pretty easy to be like, yeah, I don't think that's going to work, whereas I've had other situations where it's not as clear, but when you look at the data, you can see that, they're, maybe they're not smiling and maybe they don't look like they're having fun, but something about that like situation where you're trying to physically contain them is clearly reinforcing because the behavior is increasing.
Yeah, that's a good point. Yeah, so there's a couple issues. One of them is that it's in that you're forcing someone to do something they don't want to do. It's not a good way to treat anyone, to be honest.
Right.
But then additionally, it might not work, right? Even a 4 or 5-year-old can be pretty scrappy and pretty hard to work effectively with if this is your primary way of managing them. And so there are a number of problems, and I think that all of them are concerns. Do you think that one question I have is, do you use escape extinction ever?
Not in the traditional sense of the force prompting and things like that. So when we talk about the different like ways to apply escape extinction, we'll kind of get into that a bit more. But I never physically, force someone to do something. We do get a little bit more intrusive with expectations. So I usually use shaping and build towards a goal. So like, for example, if we were trying to work on someone like eating new foods or something like that, we don't start right off the bat with like, here's a plate of new food.
Yeah.
We shape, but I've had some clients where we might get to a point where, they're sort of at the one phase of that shaping process, and we have to do what I call dropping the hammer, which is, okay, you've been for a few days now, like you haven't been going to the next step. And we've tried stepping back a bit and building you back up. Yeah. And you just, you're just, once we get to here, you're dropping your own hammer of like, okay, that's it.
Yeah.
So we will do extinction, where we would, we don't physically like force the food into them or anything, but we would have, certain reinforcers that aren't available to them until they, make the choice to eat that food or do whatever is necessary. Whatever the thing is that we're working on. And that's always a cost benefit analysis, right? Like if it was something like matching a picture or something like that, and they're choosing not to do it, then I like Caleb said earlier, I need to figure out what's wrong with my instruction. But if it's something that's more of, an independent living kind of necessity, like having a variety of foods, so you're not becoming unhealthy and obese and those types of things, then we're going to be a little bit more willing to use more intrusive procedures.
That's a good point. And that's actually something Zach and I have had some conversation about, is the distinction between kind of necessary or required activities versus skill acquisition. So going to the bathroom every once in a while throughout a day is kind of like a required activity. Somebody just can't sit there. If it's somebody who's not toilet trained, they can't sit there in a wet pull-up or a diaper for extended periods of time. So somebody might be reluctant or engage in behavior to escape that transition to the bathroom, but it's kind of like something that has to get done.
Yeah.
Versus like your example of like maybe a matching to sample activity. I don't know.
Yeah.
Like,
and in that type of situation, I would be looking at, again, shaping. Okay, so this is the problem. How do we go from like, changing? Maybe we can't physically get them motivated to go into the bathroom. So maybe initially we just set up like a shower curtain around them or something, you know what I mean? Like to keep that privacy, right, or whatever. And you get closer and closer to the bathroom. So it's like my job to figure out how to set up the environment to promote whatever that thing is that has to happen, but without using forced interactions over it. And there could be, again, I don't have as many clients now as I used to, because I do mostly training and whatnot. But so I'm not saying it could never happen, but basically, I would say since at least 2012, I haven't used any type of force. Now, that doesn't mean we might not have to use like crisis procedures or safety procedures, blocking and those types of things if someone's being a danger to themselves. But we contain that and then we continue forward with non-physical interaction. So even if we had a client who like wasn't transitioning to the bathroom, we'd be figuring out, okay, well, do we need to put the iPad in there? Like, what do we need to do to make that transition happen without requiring physical involvement?
Yeah, I think that's important. It seems like the way you were describing it, you're kind of saying that there are some different ways that we can use extinction or escape extinction that might be less intrusive than other ways. Do you feel like that's the case?
Yeah. So one of my colleagues, Steve Ward, has done quite a bit on this in terms of presenting and whatnot. And he has a few books. His Teaching Good Learner Repertoires, I think he talks about this in there, but he also just in general talks about how to like systematically change the environment, kind of similar to what I was mentioning earlier, where you go to like what the ideal would be, but then how can you just start with like the smallest requirement and shape towards that ideal by changing just like one thing and making it, harder. And he gives a whole lot of information on that. So in his article, they had a publication in Behavior Analysis and Practice. I don't have the full title, but the short title is Task as a Reinforcer, and it was published in 2017. And he has a lovely table in there where he summarizes like most intrusive extinction procedures to least intrusive extinction procedures. So I really like that. Yeah. So the categories that he came up with, and it's possible that there are others, but the ones that he talks about, obviously the one we mentioned, the most intrusive would be to have it with physical guidance. And an early example of that was Awada et al. In 1990. Then getting to like down a little bit less intrusive, containing them within the work environment and using like paced prompts where you're not physically doing anything, but you're providing verbal and gestural reminders, which is also a common practice, but can be a big issue if there's an attention component to the challenging behavior. And it also still begs that question that Caleb was asking earlier, like, but why aren't they doing it? Like I shouldn't have to sit here and tell you over and over to do the task. But Piazza, Mose, and Fisher published one of the first articles on that in 1996. The article that Steve did in 2017, the task as a reinforcer, in the table, he has that as like the middle option. So it's not the least intrusive, but it's not the most intrusive. And that's where they kept the clients at the work table, but they were technically free to go. They had just trained and conditioned that, like staying at the work table. There were no reminders to cooperate and no reinforcers available. So essentially their reinforcer was the task. So they could move forward and keep working on the task if they were engaging in good learner behaviors like attending and responding correctly and putting forth effort. If they engaged in challenging behavior, not just your typical challenging behavior of like, destruction and trying to get away and those types of things, but even challenging behavior of just guessing or just sitting there and like waiting for a prompt. Any of those types of things, the task would get removed and they would just wait for the learner. And when they were ready, they would bring it back, which is the exact opposite of what we're often trained to do, right? Like people would say, oh my gosh, you're reinforcing that escape behavior. But generally speaking, a lot of the clients that we've encountered that engage in this type of behavior, especially the more of the learner barriers where they're just waiting for prompts or they're just guessing and they're really impatient and they're just like responding. The issue is that the negative reinforcement, no matter what you do, negative reinforcement is the ticket for them. Like you could have a whole fair available of things that they would like, but in the instance that work is happening, they just want to get done with it, right? So having that set up where you get the work done faster and you get to move on to the next thing faster when you're cooperating is the most reinforcing. So I really like that study. It's a behavior analysis and practice article. So it's case studies. It's not like multiple baseline design or anything like that, but still really helpful. The next least intrusive, it would be the timeout ribbon, which we all read about in Cooper, but I know very few people who tend to use it or really like think much about it after they take the exam. But basically it's the way that one's set up is you're allowed to leave the work area, but you're denied access to attention and other potential reinforcers. And I think that one, and this was published in 78. So, like it's been around for a while. But that one, like I try to do that one with my toddler. Sometimes it gets a little bit trickier, but people who, need to do like a shutdown and have, okay, you've chosen to engage in certain behavior that makes reinforcers not available to you for a period of time. And then when you choose to engage in the expected behavior and like meet your expectations, then those reinforcers become available again. And that one's so simple. That's really similar to the 7 steps, which I'll talk about in one of the other questions. But again, it's one that like barely anyone tries to use or really talks about. And then the last one, the least intrusive on Steve's table, is contingent attention. So, this is another one that was published a long time ago, 1968, from Hall, London, Jackson. And it's just as it sounds. You provide contingent attention when they're engaging in pro-social cooperative behavior. They get lots of attention, and when they aren't, you remove it. But again, it's published in 1968. And for whatever reason, you can it's really interesting to look at the progression on this table and seeing that like the least intrusive things were actually done many, many years ago, like the late 60s and 70s. And the most intrusive was actually done in 1990. But basically it seems like I have this constant analysis I try to do of like, how did we get here? Like when you look at the literature, and I have a few other articles that I'll tell you about, but when you look at the literature, especially in the early 2000s, there were plenty of people publishing on these alternatives. So how did we get here where like in the 90s, people figured out, functional treatment and were using forced prompts and things like that. And then in the early 2000s, people were exploring alternatives to that, but then somehow the force prompting and the pace prompting is what like held out over time. Like I'm really curious about that sort of just historical perspective on things.
Yeah, it seems like somehow it was selected, culturally selected for some reason or another.
Which is so weird because it's not like, it doesn't feel good. Like none of us I hope not. I hope none of us like it. So in terms of it being selected, like, I think obviously it's effective and it can require low response effort in terms of your thought, right? Like it doesn't take a whole lot of thinking or planning to just force someone to do something. You just do it. Whereas a lot of the things that I talk about with shaping and really making sure you're comprehensively addressing all of the issues, the full picture, that does take a lot more training and expertise and analysis and assessment of the situation.
That's great. That could speak to why this has been selected because, are you familiar with the Dunning-Kruger effect?
I am, but it's been a while since I've talked about it.
Okay, well, so basically, so the Dunning-Kruger effect, basically, it's kind of on this graph where you have experience or expertise on your x-axis and your y-axis is confidence. And, it's this effect where if someone learns a little bit about something, they become very, very confident that they know everything about it. And then as they learn more, they get more experience, they actually find that you feel less and less confident. You kind of bottoms out before it starts to increase again as someone becomes an expert. They gain more confidence. But I think that some of the use or maybe the overuse of escape extinction or extinction in general is that we have a lot of folks who have kind of a base level understanding of the function of problem behavior. And so if you have some sort of analysis that says, okay, the behavior is maintained by escape, then we should not give escape. It's very simple. And if we have a behavior that's maintained by attention, we should not give attention. Very simple. But maybe as we progress as practitioners, clinicians, we start to learn, there's some side effects to this, and maybe we should be considering it. I've had my fair share of battles, and it doesn't feel good, and it's very it's effortful in the moment, and but it doesn't help build rapport with our clients, and it doesn't help us shake the kind of long-lasting impressions the public has about us. But I think that this may contribute to why it's been kind of going on and on, is because the simplest procedure, conceptually, is to just not give the reinforcer.
Yep.
I also wonder if there's something about the direct contingency of the person implementing the procedure, where I think some of the less intrusive procedures take a little bit longer to be effective, where if you're working with a small child and they don't want to go somewhere and you just kind of move them there, like there's an immediate effect and you kind of move on with whatever you're doing, opposed to maybe having a delayed effect. So I'm wondering if there's also something about just the direct contingencies of the people implementing.
Yeah. Of course, that does nothing for the child as they get older and have to, like, you can't physically move them.
Right.
Exactly. Eventually it'll like reach a point where you're like, this doesn't work anymore.
Yeah, it does catch up with you.
But I think, yeah, that could be part of it too. A lot of the people in our field initially were just doing EIBI, where they only had like 2 to 5 year olds, and they didn't have to once the kid went to school, they never saw him again.
Right.
So it's with most 2 to 5 year olds, you can just do that, and it's not a problem you have to encounter after that. So then that can lead to more use of it as well.
Yeah, very interesting. Oh, I love that discussion.
Hey everyone, it's Caleb again. If you're interested in getting CEs for listening to this episode, the second code word is ice, as in the frozen water you put into things to keep them cold. Ice. ICE. Ice.
Now that we've kind of talked about escape extinction as having some problems, and extinction in general maybe being having some side effects that we may want to avoid, are there any alternatives to escape extinction? So we really want to provide people with alternatives. So now that we've said, oh yeah, 80% of my programming has this in it, now what should we do?
Right. So one of the things we did with the Do Better movement in January, Steve, who I mentioned, did a presentation for us on the range of extinction. So I would encourage your listeners, if they haven't seen that webinar, to check that out, because he goes into a lot more detail about the different things and considerations with, do you have to use extinction? In terms of alternatives, though, for escape extinction specifically, there's not as much published on extinction in general. So there is quite a bit of literature relating to escape extinction and the different alternatives there. But if the behavior is maintained by like attention or access to tangibles or a synthesis of different things, you're not probably going to find as much literature. However, I would argue the same logic and analysis that supports these other options for escape extinction, you could come up with similar interventions based on the function. So one of the articles that I think should be required reading, like maybe we should all have to attest when we go to take the exam or renew our certification, that I actually hadn't even encountered, but already it was one of those situations where I was familiar with all of the information in it, but I hadn't seen it laid out so well until Steve did his webinar, is another behavior analysis and practice article from Geiger et al. In 2010. And it just provides an excellent overview of the various options available to us and this was what was published in 2010. So these are the things that existed in the literature at that time. But of course, we have Hanley and the amazing research that he's doing now with practical functional assessment and denial and tolerance training. So you'd want to add that to the list and make sure to check out his work. But these are all things that I think we're all familiar with, but they just don't necessarily get used. So they go into detail about what each one of these are. They have a table where they list what the thing is and like considerations for like when you should use it or why. All of those like analysis pieces that if you're newer to the field and you're not really sure, it can help sort of guide you there. But also if you're supervising people and trying to train them on these different things, it's a great way to just start that discussion and help train people as well. So the items that they talk about, activity choice, so just giving choices of what activities to do. Curricular revision, which Caleb mentioned a bit earlier, like why are they trying to escape the work? Like what are we doing wrong here? Demand fading, which I'll talk about a little bit more. differential negative reinforcement of an alternative behavior. So like if they ask for a break, they get to have a break. Differential negative reinforcement of zero rate. So if they go a certain period of time, they get access to escape. They have extinction listed in there. And then non-contingent escape as well. So just having, set breaks that happen throughout the session. The other thing that's really nice about this article is they have a decision tree. So it asks a question like, how is this child performing with their curriculum? And if they're having difficulty, then that's your first step. You're revising the curriculum. Like that should be your first intervention. And then if that's okay, then you go to the next thing. And it works you through like which of these interventions would be most appropriate for your situation. So again, as we develop expertise in the field, we wouldn't necessarily need those resources, and it can help instead of, recreating that wheel and like having to go through those years of like floundering and figuring out what works best. We have this amazing article for, newer people or trainees, or even if you're a seasoned BCBA, but maybe you've never had the opportunity to really think about this. It's really laid out nicely. So I would start with that article just to get more of an overview of the alternatives.
I know the article you just described, and it is like a great resource, and specifically the visuals and the decision tree, I think is super helpful. Just at a glance, you can kind of see what you can do before you actually reach extinction. So I think I'm glad you brought that up because that's an awesome resource.
Yeah, we'll make sure to link any of the articles that you mentioned, or not any, but all of the articles you mentioned, we'll put in the description. And also, is that webinar available for people if they wanted?
Yep. So there's so many different webinars in the Do Better movement. I did one on demand fading. I did one on challenging behavior. Steve did the one on the range of extinction. And then we did a literature discussion on some extinction topics as well. So there's
Amazing.
A lot. So
that is great. It's really great. And I have seen, this is my apology to you, I have seen the Do Better hashtag and things like that, but I didn't realize is it focused on escape extinction and this stuff in general, or is there other things?
Yeah, it's focused on improving our practice and getting, disseminating access to professional development for free. So people can purchase continuing education credits if they need them. But I've found that one of the barriers for people learning more about what how to improve what we're doing is financial. So everything that we do is we put the webinars out for free so people can watch them on their own time and get that information. And then if they need CEs, they can go to the website and purchase the CEs.
Yeah.
So
great.
Yeah.
Yeah. That's awesome. What I was going to ask next, I just wanted to know if you had any kind of favorite alternatives to escape extinction or things that you use a lot that you think are very useful procedures or that people might want to use in the field.
Yes. So that's a great question. And that is like in the Do Better webinars, what we talk about a lot. There's a few that I highlighted for the podcast today. So the 7 steps of earning instructional control is one of the big things. Like everyone that works with me in Virginia, that's what we train them on. And anyone I supervise or families I work with, we use it as well. Robert Schramm originally published these in the book Motivation and Reinforcement, Turning the Tables on Autism. And he and I then co-wrote a training manual so that people could train others on it. So I'm not going to go into detail. That's a whole separate workshop, but just to say what the steps are. The first one is that you are in control of preferred items. The second one is to be fun. The third one is to be consistent and clear in your expectations. The fourth one is that you have to teach the learner that following directions equals reinforcement. The fifth is to provide frequent reinforcement. The sixth is to know your priorities. So what are you actually targeting? What obtains reinforcement? What doesn't? What's considered challenging behavior, what's not, that kind of thing. And then the seventh one is that if they ignore directions or engage in challenging behavior, all reinforcement is shut down and removed. So I list those out because none of them, like me reading those off, are things that people go, oh my gosh, that's amazing. I've never heard of that before. They're all things that we should be doing. But the nice thing about the 7 steps is just that systematic, like putting those 7 things together. And like in terms of training and helping people make sure that they're really developing a good working relationship with their clients. Some people get like kind of put off by the word control and like think, oh, you're trying to control someone. It's not about that. It's just really about that relationship and helping the learner that you're working with realize like you are the source of fun and all good things. And as long as, expectations are being met, that will continue. And if the expectations aren't being met, that just shuts down. And it's their choice. They can choose to, have fun and like keep learning, or they can choose to go away from that, but it's a void. There's like nothing cool out there once they make that choice. So that's one of the big ones. There's tons of resources on that. The other big one that I think is not incorporated nearly enough in our training programs, and I don't see happening a whole lot, and even in the work that I do with the people that I supervise and train, I have to do a lot of reminders of as well, is demand fading. So sometimes it involves extinction, but typically you don't need it if it's done correctly. And one of the original articles on demand fading was from Piazza et al. In 1996, where they showed that they could reduce the escape maintain destructive behavior of a child with autism, where they used escape extinction, but they didn't use any physical guidance. That's the one where they just did like verbal prompts, and they were able to slowly increase the number of demands and bring the destructive behaviors down to zero and increase the compliance with demands. That was published in 1996. Like, why? Why is it 2019 and people don't know what demand fading is? And then Ringdahl et al. In 2002 did a study, which I really liked theirs because they didn't use extinction. They had a case where they compared two conditions. One was they would present an instruction approximately once every other minute. And then that was considered their terminal goal, that like the person would comply with an instruction once every other minute. But their second condition was just instructional fading, where they had less, so maybe one instruction every 15 minutes. And they slowly built up the number of instructions, and they were able to show that there was lower problem behavior when you did the demand fading. So there's tons of research on demand fading. Those are just two of my favorite articles. And I have like that whole webinar on it as well. But that's one, if you don't know what demand fading is, or you don't know how to properly use it, you need to look into it, because extinction should not be used at all if you haven't tried demand fading first. It's just one of the easiest things to implement.
Yeah, that's right. I use demand fading all the time. It's almost like you could make a whole career out of demand fading protocols. Almost anything you can think of. And I feel like I've used this template that just has like steps on one side and just like contingencies, a little bit of box of contingencies. Like if they're successful 2 in a row, move up a step. If they're unsuccessful 2 in a row, move back a step. And just like, I can't even describe how many times I've used the same exact template, just put in a different thing. Everything from nursing desensitization to going to the pool to increasing work demands at a table or desk, or how long you should be spending in the grocery store. It's like everything you can think of, you basically can use in this format. And it's like sometimes I just think of myself, maybe I'm not a behavior analyst. Maybe I'm just a shaper. Maybe that's all I am.
Yeah. So, but again, it's not one that a lot of people, A, are even familiar with, or B, have been, because shaping, that's more response effort. It takes more thought to think about how to break something down and fade in the requirements. And it's a lot more work. But once you know how to do it, you can't unsee it. Like, you constantly are doing it that way. So it might take a little bit more effort to begin with, but once you know how to shape, it's easy.
Yeah, it takes patience, right? I think Caleb's point about the delay is probably very true, which is that the delay to success is sometimes like you almost have to follow a rule that's like, try this for 2 weeks or whatever. You just follow some rule about how long you should be trying it, and just be patient. And then you'll find that it turns out okay.
And I've had situations where I might have come in and maybe they weren't using demand fading, and they've been trying for years to just use traditional procedures. We put in the demand fading, and we're at terminal goal in 2 days. Because that's all the kid needed was for it to be lessened and like broken down better. But that is where that dropping the hammer situation comes in. Like, you can use demand fading and shaping and get to a point where you've reached your limit and you have to put in more intrusive procedures. And that's fine. There's nothing wrong with that. But you have to be able to recognize when those situations are happening and be okay with a little bit slower progress potentially too, depending on the situation.
Yeah.
There's two others that I don't necessarily take into account as often, but I do think if you're not familiar with this topic would be helpful to look at. So one is just the idea of concurrent schedules of reinforcement. So again, Piazza published on this in 97. Hoke et al. In 2002, replicating Piazza. I'm sure there's other articles again, but look at how old these are. Why? And I think Allison Betts recently presented on this in Colorado as well. So basically just the idea that they can have a break for problem behavior, but the break for task completion is more reinforcing. So you have tangibles and you just have those competing schedules of reinforcement. And if you can make the reinforcement that's provided for complying compete and be greater, they're going to choose to allocate more responding. It's easy. So I think, again, that's one where it might take a little bit more planning on the front end to think about what those competing schedules would be. But once you have it in place, it's like, especially for the child, it's like a no-brainer, right? Like, oh,
yeah,
well,
right.
I get all of this if I just do what you tell me to. Sure. And sometimes we all need breaks. Like, how many times are you like doing work and then you just hop on Facebook for a second or something? You know, like we all need those breaks that we control for ourselves. So, you know, being able to give that control to the learners that we're working with, especially ones who don't have functional communication to indicate it to us, like they should have that opportunity. Hopefully not even with engaging in extraordinary problem behavior, but maybe just like walking away for a second and like they can give themselves a break and then come back, you know. The last one I already mentioned, it's that task as a reinforcer one by Steve Ward. He does a really good job of laying out their procedures and explaining the rationale behind it and like why they, their hypothesis on like why it works better. So I would just, it's another behavior analysis and practice article I think would be good to check out. And then there's actually one more that's not related to the alternatives piece, but just in terms of fully understanding challenging behavior in behavior analysis and practice. Can you guess my favorite journal? Ala Rosales and colleagues in 2018, they published the article called The Big Four, Functional Assessment Research Informs Preventative Behavior Analysis. And they talk about the four, like they did a research literature review and looked at the four most common conditions under which challenging behavior occurs. So as behavior analysts, preventatively, if we can address those four conditions and make sure we're building up skills in those four areas first, and even if there is challenging behavior, making sure we're addressing these skill deficits first, that should take care of a lot of the extinction issues as well. So there are four areas are communication. So being able to calmly communicate wants, needs, likes, dislikes, things like that. Gaining attention, again, in a pro-social, calm manner. Engaging in activities both alone and with others. And then coping with, tolerating, and accommodating adversity, which I think is one of the biggest ones. And that's where a lot of Hanley's research comes in as well. A lot of the clients we encounter that people are trying to use extinction with, it's really more of a skill deficit relating to tolerating aversiveness. So, you know, they find demands aversive, but they find lots of other things aversive too. And nobody's ever given them the like helped build those skills to tolerate those things. And just merely putting in extinction isn't going to change that. It's not going to teach them how to tolerate. It might even make it worse. So if you haven't checked out that article, it's another one that's more just practitioner related of like things to think about and make sure you're addressing. I highly recommend that too.
One thing I love about the 7 steps is that it really emphasizes positive reinforcement, which I think oftentimes when we're thinking about escape maintain behavior, people are thinking about not letting them escape. And that's where the extinction side of things gets emphasized. But I really think with the 7 steps, you're focusing on providing other reinforcers that I think sometimes can get a little bit lost in clinical programming. Like students might have a quote unquote reinforcement program, but how much that's actually being effective, I think, in my experience, sometimes just modifying that schedule of reinforcement can make all the difference in the world without even doing anything on the extinction side of things.
Right. And people tend to go through the motions, essentially. Like I present the demand, you are correct, you get the reinforcer demand. And that like relationship piece of that really purposeful planning of pairing and giving reinforcers and all that kind of stuff is completely missing. And that's I mean, the title of the book, Motivation and Reinforcement, turning the tables, like you're essentially turning that dynamic from the opposite of like, I'm going to come in and be this person that just like drill sergeants you through stuff to more of like, hey, I'm here, I'm your friend, we do cool, fun stuff. And that's cool if you don't want to, but we're not going to have fun. Then, Robert does an excellent job of like laying that out and explaining it in a way that makes it easy to implement too. So
very good. Well, that's excellent. Those are you gave so many resources for people to and of course me to look up because I think these are super important. You laying the foundation of the research that has been done on this all the way back to 1968. We really appreciate that.
Well, that's thanks to Steve Ward. He's one of my. It's good to have other people to talk to. He's much more on top of those things than I am. So
yeah, that is great. Thank you, Steve. Yeah, that's the idea of this podcast in general, is just to have conversations and to link everybody up with the same good ideas. So hopefully this discussion has done that. Welcome, Dr. Fryman. Thanks for joining us.
Yeah, you're welcome. Thank you.
Today, we're discussing the ethics surrounding the use of escape extinction, which we feel like is a pretty relevant topic in the field. We thought it would be good to have you talk a little bit about the Boys Town population. So do you mind just giving us an overview of the folks you serve at Boys Town and maybe just an overview of Boys Town in general for those who don't know about it?
Well, let me talk about the community of Boys Town to give you a sense of the context that I'm in, and then a little bit about the clinic that I run.
Dr. Patrick Fryman is the director of the Center for Behavioral Health at Boys Town, Nebraska.
Boys Town is a city. It's a city inside of a city. It's a city inside of Omaha, Nebraska. It used to be way on the outskirts of town. Now it's in the center of town. The city has its own zip code, its own fire station, its own police station, its own mayor. The mayor is one of the kids that live here. There's 420 some kids that live here. They live in very nice upper middle class homes with what you might call surrogate or foster parents. The parents live there around the clock. The parents have children of their own frequently, and they have between 4 and 8 kids per home. And all of it is structured around the teaching family model that was generated at the University of Kansas years ago by Montrose Wolf and Ellery Phillips. It's just a sort of superordinate point system. The kids come to us through a variety of means, some court-ordered, some private referred. All the kids that are here have been expelled from their homes. Most of them have been expelled from their schools. Some have been expelled from their communities, and some have been expelled from their states. But the thing to know about this campus is while you're on the campus, you're on the safest patch of ground in Omaha, and yet you're surrounded with more thugs, thieves, robbers, burglars, carjackers, and sometimes murderers than you would be anywhere else in the state of Nebraska, unless you toured a prison system. And yet there are no walls, there are no fences, there are no locked doors, and there are no armed security guards. It's a completely open campus. And our mission really is to get the kids a high school education and get them placed ultimately in a community that's away from the environment that shaped up the problem behaviors that brought them here. My staff works with these kids when they first come to the community if they have extra clinical needs. The thing about Boys Town is the treatment is living here. So my staff provides clinical services, but that's not considered the primary form of treatment at Boys Town. The primary form of treatment at Boys Town is living at Boys Town, going to school in our schools, living in our homes, and just participating in the community. And then if additional clinical needs surface, then my staff takes care of those. And that's usually face-to-face counseling. And then the findings from that or the proceeds from that are shared with the family teachers and integrated into the kiddos' program.
Nice. Yeah, I was actually on the Boys Town Facebook page just maybe yesterday or the day before, and I saw they had a little kind of short clip with the interview with the mayor of Boys Town.
Yeah.
Or a previous mayor of Boys Town, I guess.
Yeah.
He had graduated, and I was like, that is so cool. Like,
it's actually cool to see, and it's kind of cool to see the whole election process, because you get the idea that this dirty politics stuff, it's not confined to adults. These kids, they lie about their opponents. They make promises they can't keep. And I guess it starts fairly early in life.
Yeah,
but
funny.
It is cool that we have one of the kids being the mayor. It's a bit of an honorific position, but he has some influence over what happens here too. And there's always a lot of press that surrounds the mayor. This is Boys Town, although some years ago the mayor of Boys Town was a girl, and because the press came from around the world to interview her.
That's awesome.
So that's the community in general. Now, I also run an outpatient clinic for the community of Omaha. My staff primarily serves the children in the community of Omaha who are referred to us mostly by pediatricians. And the kinds of problems that they send to us are mostly routine problems. In colloquial terms, pooping, peeing, pouting, pushing, pestering, perturbing, poking, procrastinating, picking, and puking. A few of the things that don't begin with P. Or you can dig around in the DSM and find other terms for those problems, but that's fundamentally it. So the kids that are mostly served in the clinic that I run are kids that live in Omaha, not kids that live in Boys Town. The kids that live in Boys Town, they get services from us are just a portion of what we do here.
Yeah. We don't know exactly how much extinction procedures are used at Boys Town, but we suspect, given the population there, it'd be pretty hard to carry out. Do you guys use escape extinction or extinction procedures on the campus?
I know you want to talk about the ethics of that, but I'd rather talk about the politics of that.
Okay.
It's a terrible, terrible term to use. First of all, it's not even accurate. There's only one kind of extinction, and that's extinction. Escape is one batch of reinforcers from which you can create an extinction process. I don't know why that as a field we've isolated escape as the reinforcer that gets its own term.
Yeah, sure.
We have extinction procedures.
Yep.
Now you stick escape in there and you make it seem like much more than it usually is. Because what do people escape from? And escape from very aversive conditions. And so using that term points an arrow right at the kind of unpleasantness that we're generating for whatever kid is in the program. And I think that's bad politics. So there's another procedure over in clinical psychology. It's called exposure and response prevention. So you could ask that question, for whom is that procedure used? And that procedure is the most widely used clinically supported intervention in the history of clinical psychology, and it's used for populations of adults that are typically developing, children that are typically developing all across this country and multiple other countries, and there is no controversy about it whatsoever. It's escape extinction. It's just that they're so much better at politics than we are. And so they call it exposure and response prevention. And that sounds so much more benign than escape extinction.
Yeah, sure.
We use the term escape extinction. It makes it seem like we're tying kids down and making them, force feeding them or whatever it is that kids are restrained in order to they're restrained so they can be exposed to a particular condition. So I just take have a political perspective on the term escape extinction. And I think it's not doing us any favors. And the evidence for my position is the fact that there's no controversy whatsoever in the use of exposure and response prevention. There's controversy surrounding the use of escape extinction. There's ethics that emerge around the use of escape extinction. And I think fundamentally is partially a problem of terminology. And also it's partially reflective of how terrible as a field we are at politics and at marketing. We should never let the geeks into the marketing department.
That's fair.
Yeah.
Escape extinction is a technical term. It should be confined to technical environments. We should have some other term for that process or that application that we can distribute to friends and family.
Yeah, so I think that makes sense. Making the term itself is kind of off-putting with the exposure and response prevention, which I do think I agree. I feel like that's like just sounds way better. Do you use forms of that procedure at Boys Town?
Yeah, I mean, I've got a paper in Java where we were working with a kiddo with insect phobia. This kid was, for reasons I can't fathom, was terrified of crickets and ladybugs. You know, not like spiders and cockroaches.
Yeah.
But he's terrified of crickets and ladybugs. And so the other kids, especially in his classroom, knew about this. He was a big kid. And so they taunt him by sticking a dead cricket in his desk or a dead ladybug on his chair. And this kid would flip out, knock over his desk, push people out of the way, run out of the classroom. And they were going to expel him from the program. He was too disruptive for us. And one of the things Boys Town will do in situations like that is that my team have a crack at a kid to maybe save the placement. So we worked with him and did a functional assessment of what was happening and found that it was indeed ladybugs and crickets. And so we were going to do an escape extinction program, but really exposure and response prevention is how we termed it. And we couldn't get, I mean, you could buy ladybugs, but you have to buy 1,000 at a time. That's too many ladybugs for me. But you can go to these pet stores and you go buy a cricket or two at a time because people buy them and feed them to their tarantulas. So we bought a couple of crickets, worked up this exposure program for the kid. And this is key. This is something we probably don't do or maybe can't do with some of our clientele, is Kevin Jones, my co-author, and I, and the kid designed the exposure steps together. And we didn't include any step in that program that kiddo didn't sign off on. And so the initial step was him just being in a room with a cricket in a jar. But the terminal step was him holding a cricket in each hand for 20 seconds.
Nice.
Now, he endorsed that. He accepted that step, and we worked towards it. And as a result of that program, that exposure to crickets in those controlled settings and a little incentive program, we completely eliminated his cricket phobia, his bug phobia. And that paper's in Java. And that's a clinical example of the use of what you might call escape extinction and what I call exposure response prevention. And it got good like social validity, got good acceptance ratings.
Well, so I think some of the concern in the field around escape extinction specifically is, and I think if we want to use a different term, Dr. Megan Miller uses the term forced prompting, which is like, you have a 3-year-old or whatever, and he's doesn't want to do his puzzle. And so the therapist or whatever comes in and kind of grabs his arm, moves his arm through the steps of going through that puzzle, and then you could imagine trying to do this with a 5-year-old. Gets a little bit harder because they're pretty squirmy. And then you got a 7-year-old, it gets a little bit out of hand. And then you're still trying to use this procedure, forced prompting procedure, when someone is 12 years old, you got a fight on your hands. And so our thoughts about this kind of forced prompting was that's where it wasn't necessarily desensitization, but the idea of forced prompting that we have a concern about, maybe the use of that in the field. Do you have thoughts about that?
Yeah, I do. I think that there's more involved in forced prompting than extinction.
Absolutely. Yeah, good point.
And one area where we would use what you might call escape extinction here is when we do timeout.
Yeah.
Okay.
So, because the kids will try to get out of the timeout chair, and up to a certain age and size, we'll restrain them in the timeout chair. But the cutoff for us, and I've said this to all my staff, is 3, because the kind of resistance that a 4-year-old or even a big 3-year-old can exhibit ends up recruiting the kind of interactions between therapist and kid that go way beyond escape extinction into something you might call forced prompting or even worse.
Sure.
But with a little 2-year-old who's facing timeout for the first time, and they kind of gently try to get out of their little chair, and we just put a little arm across their belly and hold them there until they stop crying. That's a fairly gentle procedure.
Absolutely, yeah.
It is escape extinction fundamentally, But you do that same thing with a 4-year-old, and you get bitten, and your hair pulled, and they're screaming and spitting, and you got a whole different thing going on. And
Right.
anybody watching it would be offended by seeing what's happening. And so, even though that would be effective, very effective, and my suspicion is that escape extinction and force prompting probably are very effective if they're applied systematically, rigorously, and over enough responses. But at some point, they're going to be unacceptable to anybody that is witnessing the procedure. And, really at that point, we should probably back off and try something else, even though we have something that works.
Yeah, that's a great point.
Well, you remember Cibus?
Yep.
Well, that worked really, really well. And the procedure that Cibus was used for, these are very self-injurious individuals who are really damaging their skulls and their bodies, maybe even tearing limbs off, banging their heads into very hard surfaces. And after a couple of trials of Cibus, all of that calmed down to a narrow repertoire that was not harmless, but not nearly as harmful. But we don't use Cibus anymore. Cibus attracted a lot of negative attention because it lacked social validity. It lacked social acceptability. We have a lot of that in our field. I did a study on treatment of thumb sucking way back in the 80s, and we used aversive taste treatment. Pretty straightforward. We put it on the thumbnails of the kids that were in the study. Immediately upon using the aversive taste, chronic thumb sucking went to 0 levels across 7 kids in a multiple baseline design. I published a paper in the premier journal in pediatric medicine called Pediatrics. It recruited a lot of national attention, all of it positive, except it recruited the ire and the attention of the world's leading pediatrician at the time, T. Barry Brazelton. He got very public with his opinion, and he also tried to convince the editor of the journal to retract the findings because he said the findings were indeed dangerous for the children of our nation.
Wow.
Now, on one hand, he and I exchanged letters back and forth, and I got him to see our point of view. I didn't agree with him that the treatment was dangerous. He had kind of a dynamic orientation, a psychoanalytic orientation. And so he thought there was a lot more going on with thumb sucking than I did. But he did me a favor in that he demonstrated to me that this very effective treatment lacked social validity. And so I revised that whole approach to thumb sucking by including a motivational component. We still have the aversive taste treatment, but the motivational component attracts positive attention. And so we've done social validity measures on that thumb sucking treatment and got very high ratings for pediatricians, child psychologists, and parents. Well, and my fundamental point here is we have procedures that work really, really well, but we don't do very much to package them so they're more acceptable to people that don't understand what we're doing. Escape extinction is really a bad way to talk about that procedure. Force prompting isn't much better. Everybody likes sex. Without it, where would we be? But if you talk about it the wrong way, you're going to get yourself in a lot of trouble. And if you do it the wrong way, you're going to get yourself in a lot of trouble. You got to be really careful about sex. You got to be careful how you talk about it. You got to be careful how you do it. And you got to be careful who you do it with. I think we all understand that. And if we don't understand that, society will arrange for us to understand that fairly quickly. And I think the same thing is true with some of our procedures. We got to be careful how we talk about them. We got to be careful how we do them, but we have to be careful who we do them with. And just because they work doesn't necessarily mean we should just go out there and blanket the population with them.
Yeah, good point.
Yeah, I think that's a great point and a very, very funny analogy. I like that. When thinking about the example of timeout, right? So once kids get above 3, you don't use the physical prompting usually to keep them in that timeout chair.
Right.
What are some alternative procedures that you do use sometimes if you can't use what we're calling escape extinction?
Yeah, there are a couple options I think that people have used for timeout. Like Ed Christopherson at the University of Kansas Medical School and Children's Mercy Hospital in Kansas City uses brief timeouts. So as soon as the kiddo does anything that is inconsistent with escape, like they take a deep breath or they momentarily stop whimpering, he lets them out of timeout right then. And so what he's looking for is any kind of a response that's appropriate that escape from timeout could reinforce. And I've got a couple of people that work for me that use that procedure. Then we've got a backup procedure where you put a child in timeout, they resist, get out of the chair, fight the person. And so we'll back that up with putting the kiddo in their bedroom until they calm down. Once they've calmed down, then they come out and do timeout, and you go back and forth until you get compliance with the timeout chair. I guess those are two options.
What about thank you for that. What about for maybe adolescents? So thinking beyond the students that are the little kiddos, what about the larger individuals? Any alternatives that you typically have used with that population?
Well, I think the word escape probably fits our population on this campus. Remember, I said on the front of part of this, I said we have an open campus, no walls or fences or locked doors. We do have a police department. Kids will leave the campus. They'll walk off when nobody's looking and head into various parts of Omaha. Sometimes that's less than enough for them. Like these kids will walk off campus and then head into two of the worst parts of town and come back to us sadder and wiser individuals and very much willing to join us again because of the harrowing experiences they've had in those bad parts of town. But once they've left, when they walk off campus, they've escaped. And we just send our police after them and they bring them back. And so in a sense, that's kind of escape extinction, and they're forced to stay here. Now, they're not exactly forced to stay here. There's another level they can go to, which is called juvenile detention or gladiator school. And if they have a choice between going to gladiator school and staying on our campus, they're always going to choose the campus. They're just not always as aware as we are of what the next option is if they keep running off the campus. But that's what we'll do. We'll just use our natural authorities here to go get the kids and bring them back and return them to their homes, change their point system so they're on a subsystem and have to earn their way off. So there's a punitive dimension to running away. And then just reintegrate them into the program. As far as teenagers in general, it's extinction itself, where you just cut off all reinforcers, is kind of hard to implement.
Right.
And even with kids that are with disabilities, kids with disabilities can find a lot of enjoyment in a piece of string. So you kind of have to eliminate so many things in order to create a true extinction procedure for any human being. And it's particularly difficult with adolescents because they got access to all the electronics. Right. Sometimes they just like being alone. So you put them in their room and you think that's going to do it. And it doesn't, because all they wanted to do was get away from their parents in the first place.
Right.
But as much as we possibly can, we try to do interventions that have an aspect of extinction to them. One of them is grounding, but not the time-based grounding that everybody across the country uses. Time-based grounding actually is I hate this term, but an establishing operation for more misbehavior more than it is a consequence for misbehavior. Because what you do with time-based grounding is you take this commodity away from these kids called freedom to do what I want to do. And as a result, the value of that commodity skyrockets.
Right. Yep.
And you don't give them any option to get it back other than pass time, which is very difficult for human beings to do. It's really challenging for a human being to do nothing. And so what the kids will do is engage in misbehavior to get their commodity back by sneaking out or threatening suicide or becoming so miserable the parents can't tolerate their company anymore and they just give up. Our procedure is task-based grounding. So the kids are grounded entirely. And what that means is basically extinction from anything enjoyable, no electronics, even dessert. We might even take away dessert, no freedoms to leave the house. And we give them a bunch of jobs to do. And once the jobs are completed, then they're free to do what they want.
Nice.
They can earn their way off.
Yeah.
So while that's happening, while they're waiting to decide whether they're going to do the jobs, basically it's an extinction procedure. And then once they start doing the jobs, they're generating outcomes that they prefer. The ultimate outcome is freedom.
I love that. One thing I'm wondering is, if someone was refusing to do something, because a lot of times the force prompting is a response to someone refusing to do something. They're saying, oh, no, you're not getting out of that. We're going to finish this puzzle or we're going to finish this task. Now, when someone's in a a teenager, you're not going to do the forced prompting. And so
No.
what are the procedures that we use to get people to do the things we're asking them to do without doing this sort of forced prompting?
The biggest problem in all of medicine, by far, is medical noncompliance.
Right.
So physicians, behavioral health specialists, people that do what I do, we have interventions we know that will work, and we prescribe them routinely for our clients and our patients, and then we're routinely frustrated because they don't do them. And the question is, how can we get them to do them? We can't force them to do them.
Exactly. Right.
So we have to think of ways to make the activity that we prescribed or the intervention that we prescribed attractive enough for the person to pursue. That seems like a behavioral question to me. Now, I don't have specific answers for your question. What I have is a specific perspective. And that is, it's sort of incumbent upon us to rearrange the inducements in the environment to make completing that puzzle more attractive than not completing that puzzle. And I think it's pretty primitive to force the kid to do the puzzle. Maybe we should think about ways to make that puzzle more attractive.
Perfect. Yeah.
Yeah, I agree. That's a really good point. Like kind of thinking about like how we can get people to want to comply rather than just forcing the issue. Well, this has been a really interesting discussion, Dr. Fryman. Thank you so much for being with us. Is there anything that you think would be important for people to know related to the ethics of escape extinction that you haven't already touched on today? Anything you'd like to add?
Well, again, I think I want to address the politics of it rather than the ethics of it. And there's some research that a guy over at the University of Nebraska Med School is coming out with. He might even have a paper in JAVA pertaining to this. He recently did a presentation at Babbitt about it, that it involves effectiveness versus process variables in the interventions that we prescribe for parents. And what he's found is that parents will discount the value of effectiveness in favor of some process variables, meaning if the therapist is warm and accepting and is very good at listening and validates the parent's perspective, the parent will prefer those kinds of interactions and discount the value of the effectiveness of treatment, and meaning how effective the treatment isn't as important to the parent as how they're treated when the person is prescribing the treatment. And I think there might be a little bit of a tendency to force feed the people that we're prescribing treatment for, not the kids, but the parents. And we're not taking into account the process variables that are involved in the interaction when we're prescribing forced feeding or forced choice or various dimensions of escape extinction.
Yeah, sure.
And I suspect that the complaints about those procedures are primarily coming from the consumer, at least initially. And that may partly be a function of how that consumer felt they were treated by the person that did the prescription. And maybe if we were a little better at taking into account these process variables and treating these parents with dignity and respect and warmth and acceptance, we might get a little further with our prescriptions.
Okay, we're back after having had some really great interviews with both Dr. Pat Fryman and Dr. Megan Miller. What did you think, Zach?
Well, I think I have a lot of things to think. I really like these interviews, and I thought that, I thought they were just the perfect people to have on the show. So first thing I think is we should probably say thank you, because I just really enjoyed the time that they gave to us to talk to them. So thank you, Dr. Megan Miller, and thank you, Dr. Pat Fryman. So I had a lot of things to think, and I hope we have a chance to outline them in the next 20 to 30 minutes. And I'd love to hear what you think, Caleb, too.
Yeah, so we had some specific questions that we generated and that I think we had thoroughly answered from our interviews. And the first question was, we wanted to know about some of the ethical considerations around the use of escape extinction, right? So like it's a very common procedure in our field. I think there's a lot of literature on this, but really thinking about like what are the ethical implications about the use of that in everyday practice?
Yeah, I think when we talk about extinction, there are different types of extinction. We have the attention extinction, escape extinction. I think we talked about escape extinction mostly because it kind of involves aversive stimulation, right? It like requires it.
Yeah, and also the procedures that are often that we think about when we talk about escape extinction they're pretty intrusive, I guess, right? Like that's what we were talking about to begin with, like force prompting.
Yeah, that's right.
Kind of forcing somebody through a task that maybe they're not a fan of doing.
Right, and sometimes it kind of looks like the thing that we call follow through ABA, which is just following through no matter what, not thinking about positive reinforcers and just kind of powering through. And so we kind of zoomed in on this particular issue. You know, the first thing that seemed to be brought up by both Dr. Megan Miller and then again when we talked to Dr. Pat Fryman was that there seems to be some social validity issues related to this topic, right? I mean, people don't like the way this looks, and I suspect people don't like the way this feels.
Yeah, and also it can possibly make things worse, right? Like if you try to follow through and then somebody, the client that is, engages in more severe escape behavior, then you could actually end up just reinforcing or shaping up some worse behavior than maybe you started with, which isn't a very good thing.
Yeah, exactly. Yeah, I thought it was interesting because Dr. Fryman mentioned they might use a procedure like this, but he recommends people stop at about 3 years old, which is actually younger than, I kind of thought, but it makes perfect sense. Definitely when someone's young, it's easier to kind of teach them, some rules and give them some basic compliance lessons or whatever. But once they get 4, 5, 6, 7, all the way up, it becomes way more difficult.
Yeah, yep, that's right. So not always great social validity with the use of escape extinction, right?
Yeah, I think also just thinking of our relationships, right? Our relationships to our clients, our relationships to our parents or teachers or whoever, if people are looking at the procedure and they're not feeling good about it, then, it just doesn't help our relationship.
Yeah, that's a great point, Zach. I think what goes along with that is that this type of procedure or procedures like that can affect the public image of our field, right?
Right. It can go beyond just our client and our parents. And that's a great point because it's not just our small circle of people that we're interacting with. If you multiply this by the 35,000 BCBAs or whatever there are, you get a public image issue.
Yeah, that's right. And that kind of ties into also what Dr. Fryman was saying with his example about sex, right?
All right. Yeah. Yeah. I thought that was funny.
So I think one of the points Dr. Fryman was making was that we have procedures that work well, right? We have empirically valid procedures. One of the issues is we don't always do a great job at packaging them well for the people that we're implementing them with.
Yeah, right. Yeah, I mean, when he mentioned the research that he had been seeing about social validity and how basically the way you're coming across, like the way you're packaging your treatment from the first time you meet the person all the way through, there's some research that shows that what actually matters most, even more than maybe effectiveness, is these other variables about how we're perceived and how we come across as friendly practitioners and that we're actually caring for the people that we're working with and not just running through some procedures.
Yeah, right. So can you imagine, and I think we do this sometimes if we're doing a really excellent job, we have something that's both effective and takes into account the process variables of like finding an intervention that people like. And the way we explain it and the way we implement it is in a very friendly, like supportive way that people really buy into. And I think that's right. That's ABA at its best, right? When you have both of those things come together, you have something that works really well and it's delivered in a way that is really personable and accepted by people.
Yeah. And I think, on the flip side of that, Dr. Fryman mentioned that, there were a couple examples that he had from Cibus, which, by the way, I think we should just describe what Cibus is a little bit. I didn't want to interrupt him when he was talking about it, but I thought we should describe it here.
Yeah, right. Because I remember learning about Cibus when I was in grad school. So Cibus was essentially this electric shock device that was used with individuals with really severe self-injurious behavior. And I remember watching the videos of this where, you would see just like a profound change in behavior in a good way, right? Like these kids that you could just see like they were tormented by the fact that they engage in such self-injurious behavior. And when this device was placed on them, they didn't engage in as much of this behavior. And there's also like some other things that necessarily weren't measured, but like you could just see like,
yeah, they looked like more relaxed when the device was on. Yeah. I know people probably won't believe us when we say that, but like, is that on YouTube or something?
Well, I think the video is probably it's probably online or something. But I just remember watching that, and the whole idea of this example is that was something that was like really effective, but it was not socially valid.
It's like it's two-sided, right? Because it's like we can definitely understand why people are concerned about the use of shock. And I don't think we're going to get into that here. Yeah. But the idea is just that, it was definitely effective, but people had concerns, and rightfully so, about that. And then he also used the example of thumb sucking, right? He had this procedure that had aversive flavors or whatever to they put on the thumb, and it was effective. But, a prominent developmental psychologist objected to it, and it caused some issues, which, to be honest, I'm glad that people are concerned, because I think it's good that we make effective procedures that are also socially valid.
Yeah, that's right. I think the point of that example is, and this is important for us to remember, is that effectiveness isn't the only thing that matters, right? I think.
Yeah. Oh, great point.
I think sometimes we think, oh, we have this procedure that has been shown in the research to be effective. I'm going to implement it, and that's it. But there's a lot more that goes into social validity than just effectiveness.
Yeah. And so we know when we think of escape extinction, Dr. Miller brought up how, you get this kind of respondent behavior, like the fight or flight things going on, and, this has some effects too, right? I mean.
Yeah, right. And I think that's where Pat Fryman mentioned that when you implement force prompting, it's probably more going on than just extinction, right? And I think that's where
yeah, I'm glad he mentioned that.
What you're talking about, like the fight or flight, you're probably providing some aversive stimulation that is eliciting a bunch of behavior. Something that I like that Megan Miller said was that one danger of this sort of force prompting is that you could suppress what she said were like natural tendencies, right? Like fight or flight is like good.
Right.
Like there's a reason why we have it, or why we're, that's like a natural type of behavior that we typically have. And it's because it's valuable. Like,
right. Yep. It was selected for a reason.
Yeah. You should have a fight or flight response. That's important. And if we, by exposing to somebody to a procedure that elicits that fight or flight, and then over time it reduces it, that could not be good for like when they're exposed to a situation where they should have a fight or flight.
Right.
So,
yep, that's true. I think the example she used was like some sort of sexual abuse or bullying, and you kind of create this person who just is completely compliant and not willing to fight back against someone taking advantage of them. And so
the goal of our clients shouldn't necessarily be to just have them comply with every single instruction without like some sort of choice or advocacy.
Yeah, that's right.
So with all that being said though, right, so we've just kind of been talking about, maybe there are times where we shouldn't use escape extinction or this force prompting, but it does seem like there are times where we might want to, let's say, like dial up a procedure that maybe is a little bit more restrictive, but it's needed.
Yeah, Dr. Megan Miller said there might be times you need to drop the hammer.
Right. So I actually, I think we've talked about this, right, Zach, where we might have like these activities that we consider are necessary activities.
Yeah, for sure.
And those might be like, you need to eat. Eating's important. Eating like the right types of food is important for maybe short-term and also long-term health. And so maybe due to the importance, you might be more likely to use a more restrictive procedure to make sure that that is successful.
Yeah, I mean, because sometimes, the alternatives are like, maybe a feeding tube or something like that. And you could imagine that, the long-term effects of that, maybe it's just worth escape extinction in that situation, or if someone's just not able to get the nutrients they need. Also something like meds, right? Medication, if you skip meds, you're going to be in a bad spot, or you may be in a bad spot. So I think meds are another thing, that you might consider using escape extinction. But remember, when I think about using escape extinction, I'm not doing it with, I include incentive programs. And, and that's one of the things that Dr. Fryman mentioned he learned over time, was that with the thumb sucking one, he added a motivational component, kept the aversive part, but it became much more socially valid. So I think the same thing, if you're working with eating or meds or some necessary part of someone's schedule, still include the positive reinforcement component, right?
Yeah, that's right. It's important. And I think it comes down to also, I think Dr. Miller mentioned like a cost benefit analysis, like kind of like weighing the cost versus the benefit of a certain intervention in relation to the type of behavior that you're dealing with.
Yeah, I think that's right. When you think about the cost benefit analysis, maybe you don't just jump to the kind of most intrusive escape extinction procedure. Maybe there are some other procedures that are less restrictive that work just as well. So maybe we think about those type things.
Yeah, right. So what are some of the alternatives that our guests came up with? They had a bunch of alternatives, actually.
Right. Yeah. I mean, so Dr. Megan Miller described how you can just essentially wait someone out. So as long as you're controlling the reinforcers, you're the person who has access to the reinforcers, then that means you can just wait. And as deprivation of these favorite items starts to increase, you'll start to see some compliance related to that, and you don't even need to force someone. You just wait them out.
Yeah, exactly. And so I think that as long as you have positive reinforcers, you could probably do all right.
Yeah, that's right.
Dr. Miller talked about concurrent chains procedures, which I know, Zach, you and I have used these in the past, where we might essentially give clients a choice, like two different choices. And if they choose to do work, maybe then there's like a really dense schedule of positive reinforcement available, versus maybe they choose to take a break and there's negative reinforcement available, but just not a lot of positive reinforcement. So you almost get a choice between two different conditions. And as long as you have positive reinforcers, you should be all right.
Yeah, I like the discussion actually that you and Dr. Megan Miller had, because you guys were talking back and forth about how it's like, why is it that this person doesn't want to learn, or why does this person not want to work on their activity? Well, it's like, that's the main thing to be thinking about. And so if someone, I think people are worried, and I understand it, but it's like people are worried that someone's going to take a break all day. It's like, okay, but to me, it's a little bit kind of sad. If they take a break all day, that means that they'd rather just sit and do nothing than interact with us and do the activities that we've planned. And I think that's kind of sad.
We can do better. See what I did there?
Yes.
Yeah.
That was good.
I was putting in a plug for the Do Better movement.
Yeah. Yes, very good. We could hashtag do better.
Yeah, that's right. Something else we talked about was, and this is along the same lines of reinforcement, right? Is sometimes, and I'm not saying this is always the case, but I think sometimes people might fall into this trap of kind of going through the motions of providing reinforcement, but
right. It's like reinforcement in quotations.
Yeah, like maybe a student has a token system, but those tokens don't actually function as reinforcers. And then at the same time, if we're implementing escape extinction, then is it really just escape extinction alone? Like, I think those things can happen.
Yeah, because Dr. Fryman mentioned, like, it seems a little bit primitive to make someone do something that they don't want to do. And I felt like, yeah, primitive is a pretty good word. It's like we pay lip service to the whole idea of positive reinforcement, but then like ultimately, if they're not choosing to do work, it's not positive reinforcement.
Right. And especially because we have some pretty effective technologies as far as using positive reinforcement, but also combining that with things like demand fading or desensitization to, gradually increase the amount of work somebody's able to do or the amount of aversive stimulation somebody's able to tolerate, and almost like errorlessly kind of increase that over time.
Yeah, and I think that, I mentioned how I use demand fading all the time. I know that you do too. It's just a huge component. And I can't remember exactly what Dr. Megan Miller said, but it was like, if you haven't heard of demand fading, like, you should get into it. She said something like that. I can't remember.
Hey everyone, if you've been listening to this whole episode and you're interested in getting ethics CEs, the third code word is pocket. As in, I just put my Hot Pocket into the microwave and I'm waiting anxiously for it to be finished. Pocket. P-O-C-K-E-T. Pocket. When you finish the episode, head over to functionalrelationspodcast.com to purchase the 2 ethics CEs for this episode. Yeah, and then in addition to demand fading, there was reference to a paper that we'll put in our notes about, I believe it was by Geiger, and it kind of provides a flow chart or a decision tree about how to choose the right intervention for escape, maintain, problem behavior.
Yeah.
And it doesn't necessarily involve escape extinction, kind of gives you some alternatives depending on the specific situation. So I do think that definitely I'd recommend people check that out, because that can be just a valuable thing to improve your everyday practice and a resource to share with other people, right? So if you're supervising people that are working on their hours for their BACB, maybe that would be a good thing to provide them with. Or like I said, just to like improve your own clinical practice.
Yeah. Or if you happen to be a student of behavior analysis and, you're talking to your supervisor and you want to bring some of this stuff up that you've been learning on this podcast, this paper, you could maybe go over it in your supervision. Seems like it could be pretty useful for everyone.
For sure. Yeah. So I think overall, we learned a lot about sort of the ethical issues that could come up around the use of escape extinction. And then we also heard our guest talk about some really great alternatives. So rather than jumping to escape extinction, there are other ways we can treat escape, maintain, problem behavior that may be not only effective, but maybe more accepted by our consumers.
Yeah, so I was thinking it'd be a great opportunity to kind of mention we kind of did a little teaser, the hashtag Do Better movement, but I think that some of the webinars that Dr. Megan Miller talked about would probably be very useful in diving more into this topic.
Yeah, for sure. And I think we can include a link to that in the show notes. So definitely check that out.
Yeah, for sure. Along with those hashtag Do Better webinars. And, you should check them out on Facebook. They have a great page, all the things they're working on. And they are working on a lot of things. You also might check out the book that Robert Schramm and Megan Miller put together called The 7 Steps to Earning Instructional Control. I think that could be a great resource as you dive deeper into this. This is one of the topics that's very important to me. And I know it's important to you, Caleb, too. That's why we did a whole episode on it. So the ways to get more involved in that is, check out those resources. We'll put them in the notes of the podcast. And also, I just want to say thank you, Caleb. Thank you for this episode.
Thanks, Zach. Always a pleasure. And remember, if you have been listening and you want to get CE used for this episode, you can go to our website, functionalrelationspodcast.com, and all you need is the code words, and you can order up 2 ethics CEs.
Nice. And for those of you who want to support us in a different way, maybe you buy those CEs, but maybe you don't need CEs right now, but you still want to support us. You can check us out on our Patreon page. It's www.patreon.com/Functional Relations Podcast. And we'd really appreciate your support there. It keeps us going. We're going to try to get some better mics for season 2. We're going to, and we just got our shipment of stickers in, so that'll be fun. When you go to our Patreon page, you will, and you become a member, you can get free CEs, right, Caleb?
That's right. Check it out.
All right. Well, thanks again, and we'll talk to you later.
Bye-bye.
Yeah.